Computed tomography is responsible for a very high dose of radiation of the patient population. Throughout the years, the number of CT scans performed have increased drastically. Because of this, the ways to reduce radiation dose to the patient is even more important than ever. The patient population at higher risk for increased dose are children and the elderly population. There are also certain body organs that are more at risk, such as the breast and the thyroid. It is important we take measures to protect both patients and specific body parts when possible. Bismuth shielding is one way to reduce radiation during a CT scan. Its function is to remove lower energy photons that do not contribute to the image but do contribute to patient dose. Things to take into consideration when using bismuth shielding is the patient's body habitus, position, and the number of layers within the bismuth shield. Bismuth shields are placed within the imaging field of view. They are usually made with 0.85 to 3.4 grams per centimeter of bismuth within the shield. They are placed over areas of interest such as eyes, breasts, thyroids, or gonads. Bismuth shields are very easy to use. They are placed directly on the patient and do not cause any discomfort. They come in all sizes, including adult versus pediatric, to properly fit each patient. In a study done to test the absorbed dose to eye lenses in head CT examinations, bismuth eye lens shields were used. The study focused on patient dose and image quality with the use of the shield. A CT-DI phantom was used with shielded eye lenses and axial scans were performed. There were 3 setups, one at 0 distance between the shielding system and the phantom, one with a 4 centimeter distance, and one without the shielding system at all. The results showed that the milligray of the entry surface dose of the phantom was lowest when there was direct contact from the phantom to the shield, and highest without the shield. In regards to image quality, there was a noticeable difference in the images where the bismuth shield had direct contact with the phantom. It showed that there was no artifacts found in the phantom images of the other 2 setups, where the 4 centimeter distance or when there was no shield at all. Bismuth shields have the capability to be very effective in reducing patient dose in other areas besides the eyes as well. In one study, it showed a dose reduction of 34 to 41% in the breast and up to 30% in the thyroid. Despite these results, many still advise against the use of bismuth shielding during CT imaging. There are significant disadvantages to using bismuth shielding. If the shield is not applied properly, it can actually increase patient exposure because of the AEC detectors. In the study of CT gradient attenuation induced by shielding, it showed that there was a correlation between bismuth shielding and increase in Hounsfield units. The increase in these units can cause misdiagnosis by improper imaging, for example, a cystic breast lesion being diagnosed as a solid mass. Bismuth shielding also leads to poor image quality, which is one of the major cons in using them. They can cause streak artifacts and increase image noise. Other radiation reduction techniques have also been shown to be effective without losing image quality. In addition to bismuth shielding, there's out-of-field shielding that can be placed to protect the patient's radiosensitive organs that are not being scanned. This type of shielding helps to protect against patient dose received from scatter. According to the article, Bismuth Shielding in CT, Support for Use in Children, additional radiation reduction techniques are reducing tube current time products, using tube current modulation, reducing KVP, and limiting both scan regions and multi-phase examinations. Siemens Medical Solutions also developed X-Care. This reduces patient dose to radiosensitive areas. Shielding is vital in reducing patient dose. Though there are many other techniques, the most effective would be to use as many as possible. If a facility does not offer bismuth shielding, then the CT tech should try their best to use out-of-field shielding. After speaking with fellow coworkers, I have learned that many CT techs do not utilize shielding as much as they should. They explained it slows down the process or causes artifact, which may require a repeat scan without the shield. I think this is a process that needs to be more consistent if we hope to reduce patient exposure to radiation in the future.